Hello and welcome to Module 1 of the Online Dental Implant Assistant course. I will talk you through each module where there will be a couple of videos to watch. We hope you enjoy attending the course. Module 1 Objectives. Define your role and responsibilities as a dental surgery assistant. Insight into the value of effective teamwork that achieves favourable outcomes that help the patient, the team and the clinic. Plan your development and progression path as a dental surgery assistant. The role of a dental surgery assistant. A dental surgery assistant is a crucial member of the implant team. They are heavily involved in all stages of the patient's implant journey. Dental surgery assistants are involved in preoperative stages, such as educating patients about what to expect before, during and after surgery, and ensuring all equipment and materials are available, sterile and ready for surgery. With additional training, a dental surgery assistant can also be involved in diagnostic appointments, such as taking radiographs, impressions, photos, and shade taking. During the implant surgery, a dental surgery assistant will ensure the patient is comfortable, maintain a sterile environment, ensure the dental surgeon has a clear field of view, and assist throughout. Post-operatively, the dental surgery assistant will continue to care for the patient and give post-op instructions. They will also ensure the instruments are sterilised after the use and the equipment is maintained. A dental surgery assistant will also assist with the restorative aspects of the treatment. Thus, they will also understand the restorative implant components and processes and be involved in impression taking and final fitting of implant restorations. Additional responsibilities of the dental surgery assistant. Some of the additional responsibilities involve inventory of stock control of implant consumables and components, liaising with suppliers and laboratories, providing pre- and post-operative instructions to patients, and maintaining accurate records. Also assisting with diagnostics, pre-implant planning. Additional skills of the dental surgery assistant include also intraoral and extraoral photography with recognised radiography qualification, taking CBCT images under prescriptions from the practitioner, taking impressions including digital intraoral images for diagnostics. Here's a day in the life of a dental surgery assistant. Here's a few photos to demonstrate a day in the life of the dental surgery assistant. So you can see we're involved in the surgery process from setup all the way through to post-op. Teamwork. Some of the relationships will look obvious, but the external relationships, for example, suppliers or personnel who maintain your equipment, are just as important as the internal ones or the team you work with at your clinic. The whole team must be together to achieve those desirable outcomes that benefit everyone, not just the patient. Good team versus bad team. In dentistry, having a good team makes life easier for everyone. Implant dentistry is no different. Being part of a great team who communicate regularly, share tasks and work together to achieve great outcomes makes your role as a dental surgery assistant more enjoyable. It's important to remind ourselves how working with a great team really is. The implant team treatment coordinator. The treatment coordinators are part of the implant surgery team. The best comparison of a TCO is like an air traffic controller. Air traffic controllers aim to move the aircraft safely and efficiently through airspace, helping the crew to take off and land safely on time. Now apply those aims to the TCO role. They move the patient safely and effectively through the treatment process, helping the clinical team to move the patient from pre to the post-op treatment phases. One of the supporting elements of the TCO role is dispensing the pre- and post-operative instructions for implant care. This is Brooke. This is her story on how she became a dental surgery assistant. Thank you for watching.
Hi guys, I'm Brooke. I'm just going to tell you a little bit about my story and how I became an implant nurse. So I've been a dental nurse for 10 years now, and just over 2 years ago I came here to work at the Campbell Clinic. I had no experience in implants, but it was something that I really quickly learned that I really liked. I love the surgical side of it. I love the transformation once the crown or bridges have been fitted. It's just something I really enjoy. I initially got my NEBDN diploma in dental nursing in 2014, and then I realised I wanted to keep learning, and I went on to complete my BDA certificate in dental implant nursing. Since being a dental implant nurse, there's so much to learn, there's so much to see, from really simple, straightforward cases to more complex things such as full arch bridges. There's so much that you can learn and so far that you can go with it all. So this course is here to help you learn straightforward implant dentistry, just to get your head around things, and just show you the ropes of how to be a dental implant nurse.